Welcome, everyone, to today's information session for the Masters of Science in Healthcare Leadership program here at Brown University. The program is a joint offering between the School of Professional Studies and the School of Public Health. We're very excited. One of our alums of the MHL program was just awarded an Alumni Impact Award for at the School of Public Health, and he'll be joining us at commencement for that special award. So pretty excited to have him come back and join us. He's Secretary of Health for the state of West Virginia, so he's making a real difference out there in the world. So it'll be fun to have him back. So this session is aimed at driving a conversation about the distinctions between the MHL program and an MBA program. And both of our alumni who are joining us today have both. So I asked them to join so that they can give our audience a compare and contrast and have discussion and answer your questions primarily, and be able to talk directly to alumni who have experienced both and the decisions that they made. So let's introduce ourselves, and then we'll get started with some questions. I'm Sandi Ferretti, and I'm the program director. If you've attended any of the info sessions before, I'm the voice that you get to hear on all those information sessions. I run all things soup to nuts. I have a similar type of degree to the MHL program and worked in healthcare for about 20 years before coming to Brown. So, John, let's have you introduce yourself and tell us kind of where you were at before the MHL program and what motivated you to pursue an MHL degree.
Yeah, certainly. Yeah, hi everyone. My name is John Jordan. I'm a 2025 graduate of the MHL program. In my corporate life, I serve as the Vice President of Operations for Lannett Americas. So we're a global medical device manufacturer that primarily specializes in hospital beds. We're actually the largest hospital bed manufacturer globally, and I oversee operations for North and South America. Prior to starting the MHL program, I had completed both my undergrad and a master's in business administration. And the vast majority of my career has really been in like operational leadership type of roles in the technology industry, starting in the military, moving to some other types of technology. But the last 10 years specifically have been in medical device. And I think really what drew me into the Brown MHL program was the opportunity to really go deeper into the healthcare system itself. Again, I was never, didn't have a clinical background, hadn't really worked in the hospitals and worked alongside like the clients and people that I served. And so I had, I would say, a knowledge gap there that I needed to address. So, uh, you know, through just my working experience and getting an MBA, I built a pretty strong business foundation. But again, I lacked a lot of the specifics of the healthcare knowledge. So, I really wanted to understand this kind of complex world of healthcare through an educational format, but also to immerse myself around other folks who had, vast, crazy amounts of diversity of knowledge from clinicians at the physician level, nursing level, um, administrators, pharma, all these different areas that I knew a little bit about, but did not really know in any kind of depth. I guess my depth of knowledge was pretty light. So, and really, it kind of helped me gain a understanding again of the kind of complexity of the healthcare system, things like policy, clinical leadership, public health, and just how all of these different parts of the healthcare system interact. So that was a big thing for me. And so I think one of the biggest values I could say right off the bat is going into a program like this, it really helps you understand and make that transition of kind of where you move simply from running an organization like you kind of focus on with an MBA to really understanding how to lead within the healthcare system, which was important for me because if I couldn't figure that part out, I couldn't be successful as a vendor, to hospitals all around the world.
Great, thank you.
Okay.
Ed, same question for you.
Sure. Hi, everybody. My name is Ed Bowder. I'm a paramedic here in New Jersey. I'm also an entrepreneur, and I'm currently a PhD student here in New Jersey at Seton Hall University. Um, Sandy brings me onto these meetings because my background and my path to Brown has been more circuitous than most. So I've worked as a paramedic since the early 2000s. I went to medical school for a little bit, and during the pandemic, I thought it would be fun to develop cancer for the third time. So I left medical school and finished my MBA. Shortly after that, that's when I went into Brown, and that's in medical school. I had started my own EMS education company. So what we do is we try to improve education for pre-hospital providers. That's in my business life. In my work life, as I said, I work as a staff paramedic. So I finished my MBA right before I went to Brown, and the biggest differences that I found where my MBA kind of taught how to do, I guess the way I explain it is how to do the spreadsheets, right? All right, we have this type of inventory that's coming in, and this is how we're selling it. And the MBA kind of focused on widgets, right? So my specialization in my MBA is in healthcare administration, but a lot of the stuff in healthcare administration could easily be moved to, different public services or other businesses generally, right? Whether you're selling hospital beds or you're selling whatever, it seemed to be kind of similar. The MHL program really kind of took that information we got from the MBA and explained how to actually apply it in the healthcare industry, which is something that the MBA doesn't do very well. One of the things that I noticed in the program was the MBA kind of taught us, I said, like how to enter data into spreadsheets and how to, see large inventory numbers. The MHL kind of taught you what to do with that information and what to do with that data. So if I say, my company has 5% growth year over year, that's terrific. But if I can't apply that to my healthcare system, there's really no value to having that information. So that was really kind of the biggest thing that the MHL gave me. And that was kind of the biggest distinction that I noticed between the two.
Excellent, excellent. And that's, you've kind of already covered my second question, but I'll go for it anyway, which is to say, how did you find the coursework in MHL in terms of complementing or comparing to your MBA coursework? So, John, do you have anything to add to that?
Yeah, when you think about an MBA, some of the kind of core competencies, right? You think like, finance, accounting, strategy, operations, marketing, things like that, leadership. And actually, we touch on all of those topics, in the MHL as well. But in the MBA, and kind of I think what Ed was saying too, it teaches you how to create, kind of create and then even manage value a little bit. But on the MHL, it kind of helps you understand how to now take those things and then deliver value, not just create value, but now I need to deliver it to a set of stakeholders. And so, like again, for me, from coming from the medical device, it's the caregivers and also the patients. So then you think about like those core topics I talk about, in the MBA, but then in the MHL again, you're talking about those, but then you're doing healthcare systems and policy, which is very different, right? You don't even again, I don't know about Ed's program, but from what I know in a lot of the healthcare administration types of like concentrations within an MBA, you might touch on that, but not go super in depth. And here, what was fantastic is we had people with true experience really developing policy for states and at the national level. And so just being able to access that information and have discussions was eye opening because I didn't understand. Again, I kind of understood what the words meant, but not really what all it took to do that. Um, we health technology and innovation was another thing that we really touched on. You might touch a little bit on technology like in the MBA, but here, we talked about how does technology play into the healthcare system today, but then also tomorrow. Even now we even got into touching on AI, which is everyone talks about in everything nowadays. And then, another big one for me, I think was, in the MHL, a major focus was on health equity, which was something that for me, coming from my background, I didn't honestly think a lot about before the program. And I think again, that's not something that you're really going to touch on in the MBA. But the MBA, those things that you do touch on the MBA, you do also do in the MHL, just much more focused to the healthcare system, which is to me a very different way of doing business than I think a lot of other organizations or types of businesses.
Yeah. You mentioned that your MBA had a healthcare concentration. Do you have anything to add in terms of comparison?
I mean, yeah, just kind of to build off of what John just said, I think that the MHL kind of gives you more context to actually growing whatever you're working on in healthcare. There's a lot of talk that students are going to hear about the difference that Brown University makes. Again, I'm brought on to here because I was one of the skeptics when I came on to the program. Um, and there is a difference between taking an MBA and learning that, all right, this is how you achieve growth and this is how we, manage inventories and like that, versus speaking to someone who's done it at scale and getting that kind of advice on like, all right, it's great that we want to see constant growth, but when we run into problems, how do we actually fix them? And speaking to people who have worked at government levels or have worked at, in very, very large organizations, getting that kind of feedback is something that's kind of invaluable in a program like this, where we can apply like lessons from healthcare law that aren't necessarily given to an MBA and how, changing, opt-in versus opt-out for, blood donations or organ donations, how that actually affects care down the line. And it eventually led to inform the research I'm doing now at the PhD level, because once you start to see how those policy decisions affect care, if you're someone like me and you get frustrated by that, you decided to study that further and further. So I think that the kind of difference that Brown University gives you is here's how to actually apply the things that you've learned in these programs. So an MBA teaches you, and I keep kind of coming back to like it teaches you how to read spreadsheets, where your MHL will teach you how to take that data from the spreadsheet and how to apply it and what that information actually means. And then if your MBA teaches you how to process that information in a year in a budget, your MHL teaches you how to use that data over 5 years to grow the actual business, to improve your relationship with stakeholders, and to improve whatever you're doing in that company.
Excellent. Thank you. So you both have touched on a little bit the peer learning experience. And that's sort of one of the key points in our recruiting efforts is making sure that we have a diverse audience of students so that you can all really learn from each other. You're all working professionals. And so I'd like you to comment on, how do you feel that peer learning environment enhanced the learning experience for you? You want to start, John?
Yeah. Again, I think, for me, coming in, I felt a little bit of as an outsider in the first few days because I wasn't able to maybe speak the language that some of the other folks who are embedded and work for health systems are able to speak. And so that was, obviously a little intimidating, right? You have to learn those things. I mean, my wife's in healthcare, so I've heard some things from her, and again, heard it in my dealings, but not at any level of depth. And so I think, yeah, that the what I've been able to learn and continue to learn from my peers in the cohort has been very, very helpful. Again, even when we're in class and you're getting the perspective from the professor, they're always asking everyone else to contribute. And so someone stands up and they say, well, hey, from my perspective in pharma, it's this, and from someone saying, well, hey, as a bedside nurse, it's this, and you're like, wow, these are things that I would have never even considered before. Maybe the bedside nurse was a little bit of a familiar voice to me, but not pharma. And so I think again, when you think about that and kind of compare it to an MBA, MBA is bringing people from all different types of industries, and you're not. I think a lot of people when they go into that, they're maybe not married to an industry, right? They may pivot after their MBA and go on and do something else completely different than what they were doing before. But I do feel like if you're committing to a program like the MHL, you've probably committed yourself to life, if some working somewhere in the healthcare environment. Um, and so that means you're getting yourselves around people who have been embedded in that for, in many cases, a long, long time. And that was one of the other things too, right? So these at your peers in the cohort, you've got folks who are relatively new. They're kind of just starting their career or their earlier career, and you have folks who are very senior within their career. And so even there, they may have similar roles, but they have different levels of experience and they can speak to how they were able to, how things have evolved over the last, 10, 15, 20 years, which is also a valuable perspective because you have to kind of understand how did we get to where we're at today. And a lot of the cohort members were able to kind of explain that, which was very meaningful for me.
Excellent. Ed, your thoughts?
I think one of the most important things during my time at Brown was the mix of the cohort that I had. Um, I think I was in cohort 10, and I'm still in a group chat with everybody from the cohort.
Yes.
Um, and I mean, I come from the pre-hospital environment, so a lot of my focus is clinical care, and how to improve that. And honestly, the most invaluable thing that my time at Brown gave me was you get a much larger context to, at least I got a much larger context to patient care. So my cohort had people from mental health professionals to one of my colleagues was a yogi that runs a hospital system. There's a chaplain within our system, a PA. And so coming in with my kind of, run and gun pre-hospital attitude to healthcare, it got challenged a lot, which was a very interesting experience of, I hadn't had to consider how my 25 minutes with a patient might affect them 5 years down the road. And how that actually factors into how organizations work and getting that much more kind of polished, holistic picture where you kind of start to see that there's more to the healthcare industry than what you're just experiencing. So it also really kind of takes you out of your environment and makes you have uncomfortable conversations and, challenge all those biases that you may previously have. I'm a guy from New Jersey, so I'm fairly set in my opinions. Um, and and we're more than happy to express them, but in having those conversations, like, okay, you know what, I've never had to consider how healthcare looks in rural West Virginia, right? So I've never had to take time to say like, oh, well, if we're trying to raise something or if we're trying to improve a system, I think of my environment around here where, you know, for my environment, I'm 20 minutes away from a hospital at any given time because we're so densely populated. So if I have to worry about delivering products to a healthcare network, I don't really have to worry about logistics because everything is so close here. But if I'm working in West Virginia, California, North Dakota, I have to worry about that. So getting that kind of more expanded worldview was probably the most important thing that I got out of the program.
Thank you both. The one of the things I say on these info sessions is that students come who are what I would call subject matter experts in their particular area. But the experience of the cohort allows you to sort of open up that whole broad view of the depth and breadth of the healthcare sector. So, and allows you to have that greater context of the entire system and not your little corner of the world that you are an expert on. So, and that helps drive your capabilities in your future work. So, because you have that broader point of view. So next, let's turn to highlighting an experience that was particularly valuable or transformative for you while you were in the program. We do some unique teaching approaches here in the program, so curious if there was, it doesn't necessarily have to be an experience, but knowledge or things that really stuck with you in terms of how the program helped you. So Ed, let's start with you this time.
Sure. The easy answer is graduation. Um, that it's so
Great.
yeah, exactly. How was your experience? Terrific. So it's that's always kind of the biggest experience that everyone's going to come back for. And I think that's the easy sell, right? Providence blows up over one weekend, which I was blissfully unaware of until graduation weekend. So that's a big thing to work toward. But I don't mean to be kind of like overarching here. It's difficult to find one specific thing or one experience that was more helpful than others because I found during my time, we would have a class. I'm like, okay, I hadn't thought about that before, or I hadn't seen that before, and I felt like the next day, the next class, especially during residency, there was kind of another thing that I hadn't thought of or considered before. So it's easy to kind of sit here kind of, post hoc and say, oh, I didn't know about these different type of healthcare law applications. Um, there's different types of ways that things are done internationally that I had no real awareness of. So it's difficult to say like there was one thing. I think generally the experiences in between the classes were probably the more invaluable time, where you have the time sitting in lecture and you have all these times sitting and talking about the content, but the time during lunch, after classes, the dinners we went to, where you kind of get to know your cohort a little bit better and gain that invaluable information that they have from their own experiences. That was kind of the biggest thing for me.
Excellent. And I will confirm that I've been to a lot of university commencements, and Brown really does a great job of
Yeah,
making it a really great celebration. So,
yeah. If your graduation celebration can shut down a city for a weekend, you're doing it right.
you're doing it all right. Great. John, what are your
Yeah,
thoughts?
and yeah, when I definitely echo that. I already have my hotel booked for commencement in May, even though I'm not graduating and my wife I not graduating, but just to see everyone else that I know who is, in my cohort and some of the early part of my wife's cohort graduate, and other people we know that we've met along our Brown journey. You can't. That's like something you just can't miss. I think for me, if I think about one, kind of one memory that really stands out. I believe we were doing a class. I believe we were on the Pembroke campus, and we were there, which was fantastic, right? You're in this historical, this real historic lecture hall, and you really feel like, hey, I'm here on campus. And we were having discussion around healthcare policy, and I don't remember all of the details, but again, the folks that teach that class have a tremendous amount of experience, like real world experience in healthcare policy. And but one of the things we talked about is like the experience of the cohort. And so, it's not like, if you've only gone to undergrad and you did that, 18, 19, 20-year old, you may not have, had the courage at the time maybe to really stand up and challenge. But here, when you've got people in your cohort with 30 years of experience, and they will stand up and say, "Well, hey, I disagree," or they'll challenge. And so there was some challenge in perspective between, the professor and a professional who's been in the industry for quite some time. Again, I can't remember what exactly it was about, but it was really nice to see that dialogue, like on both sides, to say, no, hey, let's talk this out. We both bring valuable experience to this classroom right now. And yes, one's the student and one's the professor, but we have different perspectives. And so, again, I can't remember what it was, but it was really great to see that, right? So it's not just like, hey, well, we're telling you this is how it is, and then go, take it for word, and then just kind of go out and do your thing. It was like, no, hey, let's talk through it. And to me, that was really impactful because it meant, hey, we're really learning, right? And two, that the students are also contributing to the program. Again, it's not a one way thing at all. So it's definitely interactive and a lot of back and forth. So I think that's the thing that really stands out to me. And there was a number of situations that I would kind of put, in a similar, I guess, in a similar lens. But that one really, and maybe some of it was the environment and why that one stands out. Again, being on the Pembroke campus. But yeah, that was a really great
Yeah.
moment for me.
And I think that's really indicative of Brown, in the sense of that interdisciplinary conversation, that we don't all come to the same conclusions with the same set of evidence. And so, and particularly around policy conversations, like what's the best resolution. So I think that's an excellent example. All right, I have one more question, and then we'll open it up to our guests. How has the program impacted you after the program with your either professional development, personal development, career growth? What's been next for you as far as impact of the MHL program? So I'll start with Ed because you have a good story, Ed.
Sure, yeah. So after leaving Brown, as I said, I started my PhD studies down here at Seton Hall University. I'm right now a behavioral economist. I'm studying choice architecture for EMS workers. So that's kind of the big 10,000 foot view of where that went. I think that the best thing that I got out of the program was what is working for larger systems and how systems are currently working in 2026. Um, Sandy and I like to have this conversation off air because I came back down from Providence. So one of the experiences that students will run into is you're going to go up to Providence for a week and you're going to get so psyched and so pumped and so excited to learn all these things, and you're going to come back to your workplace and you're going to work with a whole bunch of people who don't have the same information that you have, and that's where I always kind of ended up at loggerheads with people. Where it was like, no, this is what works. I just learned this from the people that are doing it. And so that was always kind of the most exciting part for me was, talking to people who are actually out in the field doing these kind of things. The application part, once you actually get out into the field, that's where it gets really interesting, I think, as a practitioner, because that's where you have to start having those kind of, convincing conversations with people where, like, okay, the way that we're doing things is the way that things were done in the 90s, which didn't work. And now we have to have this new type of adaptive and, kind of growthful sort of leadership of working toward having the collaborative leadership of having the whole team in sort of a flat hierarchy where everyone can contribute is not something that a lot of organizations work with right now in 2026. So coming home, getting all the information is the most fun part. And sitting on it and kind of letting it grow, bringing it back home. That was where I kind of found the fun of the work of, all right, now let's apply this information that we've gotten.
Excellent. John.
Yeah, I think for me, you know, towards the tail end of the program, I credit it to the program. I was able to take on a larger scope, and I started in the program. I just had operations for the U.S. Exiting the program, I was able to expand that to have operations for all of the Americas, which has been a unique learning experience for me, even beyond the program. Learning a lot about like Latin America and their health systems, Canada, and how those things work. Which we did do some of that, right? We studied other health systems and had to present on those during the program. So getting one of the things I would say that was really valuable was just getting me, I guess creating this sense of curiosity to want to go and learn and understand at a deeper level. Again, if I was going into that type of expansion and responsibility, okay, I'm going to go and say, all right, what do I really need to know? What's the black and white? But as you start to now have a much broader perspective of the healthcare industry, now I'm looking much, much deeper, right? Before I might have looked at the financials, what makes a buyer in those markets, but now I want to understand, okay, well, how are they funded? Just again, just a lot more details that I wouldn't have really considered before. Um, the other thing that I've found that's really helped me in my role now is not that I didn't do it before, but challenging even more so our approach in how we operate within the markets that we operate. So, getting us again to consider like the larger economics of the healthcare system and to say, hey, if this is happening within the healthcare world today, and it may seem like it's not in our realm, well, here's how it all connected together and can tie back to us, as a vendor. Or again, you just kind of, I think before you kind of come in with this narrow lens, that doesn't impact me or whatever. Again, a change in policy, we're selling capital equipment, that doesn't matter to us. Well, actually, it does, right? Because you have some domino effects. When one thing changes, a lot of other stuff has to change to adapt, and somewhere down the line, we're going to start to feel it. So that's been a major help for me. I think kind of exiting the program again, and that commencement, gave me an even greater appreciation, for the experience that I had, not just the education, but just the overall experience of it all, and the people. And as we've said, kind of, I think a few times, is you stay connected with those folks, whether or not it's like LinkedIn or like WhatsApp or email or even just like social, like private personal social media, there's probably not a day goes by that I don't interact with someone from either my MHL cohort or the people from all the MHL cohorts before and after me that I've now connected with and built relationships. But then even further than that, the Masters of Technology program, uh, because I do have somewhat of a technology background, I've connected with a lot of folks there, right? So then you don't just limit yourself, right? Coming into a program like this, it's not just the MHL folks, it's the entire School of Professional Studies, right? You'll start to build relationships within that. And then even beyond that in other parts of Brown. So I think you start to, that's something that I've seen and really bought into and have tried to, if I see a connection, someone that I know and I see they can benefit from one of the programs that's Brown is offering, I try to put it in front of them and push them for it because I'm grateful for the opportunity that I've had. So again, I do think it's a really transformative thing, and for me, it's something that I'll proudly represent Brown, every day wherever I go.
Excellent. Thank you, John.
Yeah.
All right, I'm going to invite my colleague Emma here to join us. And I think there are some questions showing up in the Q&A, so she's going to help us sort through that. So if you have questions, those of you who are on the call, feel free to pop them into that Q&A and we'll have a good conversation.
Thank you. So our first question here, how many semesters is this program?
So it's currently a 1-year degree program, which covers 3 academic semesters. So you are in school full time for a fall, a spring, and a summer term. So regardless of when you start the program, one of your summers you will be in school. But otherwise, we're the fall and spring. But students really appreciate that they can knock it out in a single year. Like it seems like I can do that. I can do this for a year and get through it.
Thank you. Another question that came in, is this course schedule compatible with somebody in either a 9 to 5 or a hospital work schedule?
Ed, you get that one.
Yeah, so I work a typical hospital schedule. My system when I was at Brown worked on a Pittman schedule, so 3 12-hour shifts a week. Typically, it was 2 days on, 2 days off, 2 on, 2 off, 2 on, 3 off was my schedule. And I'm a night shift guy, so when I was going to Brown, I was working full time and running a business, and I was a student, and sometimes I slept. So it's very doable. That doesn't say there isn't work to do. There will be, some nights where you're going to have to kind of, burn the midnight oil a little bit, but I think that's any program. But the coursework itself is certainly not prohibitive if you're working a regular hospital schedule or weird hours. I mean, I even worked overtime a lot when I was in the course. So it's the course isn't so much the question isn't so much whether or not the course is compatible to a hospital schedule, it's whether or not you're compatible to the schedule you can make around the classes. One nice thing with the residencies is that you're there for a week and all of your face time is kind of done in one fell swoop, and everything else you can kind of make your own schedule when you're back at home. So yeah, it's very workable with a hospital schedule.
John, you have more so of a 9 to 5, but
Yeah, definitely more of a 9 to 5, with some travel. But like Ed said, I mean, it's really you just got to find what works for you. There's a lot of things. If like during the week you might have an office hours that you want to attend. Typically once a week it might be 7 p.m. or something like that. And yeah, some of the night shift folks or later shift folks are on shift, and there were some who would they're joining on camera in their scrubs, or they're like, hey, I can't turn my video on, but I'm listening. Or if you're not able to make it, it's recorded and you can watch it later, right? So you don't really miss out. If again, you've got people who are working in the ED, and you never know, you just never know what's going to happen. And so they always found a way, at least from what I saw, to kind of be able to get the coursework. So yeah, to me, I think it's definitely doable. again, you can work a little bit ahead, right? So some people, you could see, all right, hey, they're very busy on Saturdays and Sundays. Like if you can see where you can see, people's submissions or posts that they're doing. Some people, it looks like they do a tremendous amount of work over the weekend. Some people are, 11 p.m., 12 p.m., posters, and you kind of started to see a trend that people found what worked for them. Um,
Yeah.
and so, yeah, you just got to find what works. But I think there's not a ton of schedules that can't find a way to make it work.
Yeah.
And
And
the
I,
staff and faculty are super receptive too. So,
Yes.
you're almost always in contact with people, whether you want to be or not.
yes, we will
Yeah.
find you in a good way.
Thank you.
I think uh, it's you're both speaking to the flexibility that the online space provides because there isn't the same kind of synchronous requirement, and that allows students like whatever their work schedule is, to find a rhythm that works for you. And we really do try to have a cadence to the coursework so that you know what to expect. Like there's going to be a discussion, there's going to be an assignment,
Hmm.
and that allows you to think about, okay, what's my schedule this week, and fit it in when you have time.
Yeah, and your peers too, pushing. We had it all the time. Hey, just a reminder, you need to make a post tonight about this, or reminder, this is due tomorrow. Make sure you get your submission in. So it's not like you're having to remember everything, and you know, if you're not someone who's on top of a schedule, or has a schedule that can be wonky a little bit, there's going to be someone else in the program that is very very on point, who will kind of help keep everyone else on track.
Excellent. I love that.
Yeah.
Thank you. So our next question that just came in, um, can you talk more about your experience with the residencies for this program, and coming to Providence for them?
Sure, yeah, I'll jump in. I kind of grew up in the Atlantic Northeast, so I'm used to the general weather patterns that we have up here. So for me, Providence is about a 5-6 hour drive. It wasn't a terribly long commute. The residency weeks are long, I will say. I mean, you are in class from 8 to 6 all day. And then, you have to factor in meals and dinners and whatever else. The school does a very good job of kind of keeping you together socially. There's on campus and kind of off campus events that you have while you're there. Um, it's a whirlwind. It happens very, very quickly, and you have to make sure that residency week is happening for you and not to you. Um, but save for that, aside from that, it's busy and you kind of feel like you had a lot of information given to you over the course of a week. Um, it's more than doable. It's always a good experience. Like I said, I came into the program as someone who was super skeptical about a lot of the oh, come on up to Providence, come to Brown University. We've been here since 1764. But all of that ended up being the best part of the program. So the time spent in residency, I think, was the most important part of the program, despite how busy and work heavy it was.
Yeah, for me, the residency was pretty much a requirement for any program that I was going to do. I needed to have that in-person connection. And I do really think that's the thing that sets the program apart. The residencies are Sunday through Saturday. Like I said, it's a lot. So for me, I would come in the Saturday before and a lot of times leave the Sunday after, just so I didn't feel rushed with travel. So you do kind of, you got your weekend, the entire week, and then the following weekend where you're kind of go go go, the entire time. So it's it's kind of like when you go on a vacation. Sometimes you're like, hey, I need a vacation after the vacation. You need almost a day to decompress a little bit afterwards and kind of go back from, okay, I'm 100% student to now I'm back now and I'm an employed working student. And now kind of balancing both of those. I think maybe some people came to the residential sessions without really like taking time off and tried to balance both. Personally, I wouldn't recommend it, right? Because I think it takes away a little bit from your ability to be present in the classroom and with your cohort. Because I do think that some of that time that you have after hours, even if for someone like me who's a little bit more introverted, that time was very, very valuable. Obviously, you connect in the classroom, but the time afterwards, whether or not it's the dinners or whatnot, were really helpful. And then one of the things that makes it really convenient is there's a hotel. I don't know, it's 100 feet away or
Across the
something
courtyard.
like that. Yeah, it's
The
across the
courtyard.
courtyard. So you don't really lose any time commuting. You can just walk across from the hotel every morning. A lot of people go over and kind of socialize at the hotel and decide where they're going to go for dinner and things like that after class every evening. For me personally, I got together with a group in my second and third residencies and did an Airbnb, was a cool experience. One of the times we rented an old house on campus, which was really nice. And so then you got even more of a feel of kind of being there and being present. So that was nice. But yeah, I think the residencies are very important, very doable. Um, it is a long day, but the program wouldn't be the program without it, in my opinion, because that's where those relationships are really built.
I think one of the strengths, like you said, it's very busy, but you get to meet the faculty in person and engage with your classmates that you're going to be engaging in an online environment with, and that makes a real difference for when you go to the online components that you've met them, you've talked to them, you know a bit about their perspective, and I think that really sets you up well for the rest of the semester.
Well,
I
it's
think
also
that
framing it as an opportunity too, right? I mean, the people that you meet in residency are like we've talked about this whole webinar. They're the people who are out there doing it. And it's different coming from your home work environment where, maybe you met the CEO of the hospital and, got to have a chat with them. But, you go up to your residency and you're having conversations with people who worked with the president of the United States. It's just a different experience, having conversations with people who are working at the level that you're working with here. And I would love to, I'd love to make it much more eloquent of like, well, the reason that it's different is because, but it just is. If you're being taught by people who are, working at very large governmental levels or who are working at levels of companies like, Google and Hewlett Packard, it's just a different experience than talking to, the guy who works at your local urgent care. It's just a different environment.
Yeah.
John, did you want to add anything else?
No, I think we touched on it again. I think, well, I guess maybe one other point would be, I know some other programs that I looked at before Brown that did have residencies. The residency might be, in the middle of a semester or something like that. And I think what works really well is, your three residencies. If you haven't looked at the schedule yet, you'll see they're right at the start of each semester. And
Yep.
so, as Sandy mentioned, you're meeting the professors, you're meeting the people you're going to be learning from right at the beginning. So you kind of build that foundation with them that then makes it a lot easier to transition to the online versus in some programs, you're starting online, and then you haven't really built that connection. Then you go in person, you do build it, and then now it gets a little bit easier. But once you've done that and you've had that time and you've done a few of the modules with them, you also have kind of balanced expectations, right? You've set an expectation for them on who you are and what you're capable of and how you work, and you understand how they deliver and who they are, their experience with, again, which makes it a lot easier when then you interact the way we're interacting today.
Excellent. Emma, any other questions showing up?
Sorry there. It looks like we have two more, so I'll do a last call here. But the first one out of the two, how do you see the CCP project playing out in your career?
Yeah, yeah, I could touch on that. My CCP was essentially around trying to find alternative payment models for hospitals trying to invest in expensive capital equipment, basically, right? You have competing priorities for limited dollars, and hospitals are trying, where's the best place for me to deploy that? And so during the program, we were able to implement within my organization some a few different ways to provide alternative payments, or alternative, let's call it alternative financing for the health systems, which really took off. I mean, to the tune of, I think at the end of the program, we were probably about 30-40 million dollars. And we've continued to expand upon that. And now we're looking at taking that to other places, including Europe, a little bit different, right? So we have to reevaluate that there again because the healthcare system is very different in Europe than here. But some of the markets where the healthcare systems are, a little bit more closely aligned with the healthcare system in the U.S., we have been able to pilot that same approach there. So for me, I think it took off. It took off pretty quick, and it was something that was directly applicable to my work, which benefited us as an organization because we were able to provide, product that we wouldn't have been able to sell otherwise to some of these health systems, and it enabled those health systems to make an investment earlier, whereas before they would have had to put off, which had some clinical impact, for them having old, outdated, unserviceable equipment in their health system.
My CCP was the business plan for my small business. So it's everything that I did is being applied in kind of my day-to-day life now.
And it really has taken off and grown quite a bit. So,
Oh yeah, yeah. I mean, yeah. Where I'm so I was an educator. I've become a national speaker in my field now. I'm presenting at national conferences now, and our coursework is available for kind of all over everywhere. So yeah, it's everything that I learned from the MHL program itself is something that I'm applying on a day-to-day basis. As I said, my CCP deliverable was actually my hard print business plan for the investor pitches we had moving forward. So I I can't that yes.
yes. Yep. Excellent. Emma,
Thank
what's
you.
the other question?
Yes, our last question in here. What advice do you have for a student applying to this program?
Do it. You're already in the webinar. I
Excellent.
say I don't mean to I don't mean to come off as glib. I absolutely do. I found a lot of times in speaking with my colleagues, my cohorts that came through this class, when you have that kind of that exploratory idea and coming to a program like this and saying, what's it all about? What are we looking at? You're already here. This is a program that you're interested in. It's a program that's going to help you. If you found the MHL program, it's because other things that are available, whether it's an MBA or an MPA, MHA, whatever. It's because it's not really fitting the needs that you're looking for. And this program might not fit all the needs that you're looking for, but you're here for a reason, and it'll probably give you a lot of the things that you're looking for in this type of graduate program.
Yeah, and it's kind of like I mean, you're here already. If you feel like apply, there's no reason, I guess, not to apply, right? The application process, I think, comparatively to some MBA programs and things like that, is relatively simple. If you are debating, hey, will I get in? Will I not? The way I see it is, you're not in the program until you apply. So don't tell yourself, no, I'm not going to make it in or anything like that. Put that in the hands of the school. Let them, do the best you can on your application, which again, I think is not overly complicated. Um, and go for it, right? And then once you get accepted, okay, now make the decision. All right, am I really ready? Can I commit to this? And then do it. Again, I there's not one person that I've spoken to over the course of my time being affiliated with the program. It's like, man, I didn't really get what I was looking for. And a lot of people were like, wow, I got what I was looking for, and a lot of stuff I had no idea, anything about. So yeah, highly encourage you if you're considering it. Go ahead, submit your application. The turnaround time, again, I can't speak to that, but I think Sandy and the team there do a pretty good job of getting those turned around pretty quickly, right? So you're not waiting months and months and months to find out if you're going to be joining the program.
Yeah, definitely. We use that rolling admissions process. We have two opportunities to enroll either in the summer or the fall. So folks have flexibility even there in terms of when you start the degree program. We have for the summer, our final deadline is this coming Monday. So there's still time. So you could,
Plenty of
and
time.
as
Yeah.
John said, it's not a horribly difficult application. So just go right ahead and submit. And June 1st is looking like our submission deadline for the fall semester. And we're especially now we're getting those decisions turned around really quickly. So. All right. Thank you, Emma, for guiding us through those questions. And thank you so much, John and Ed, for joining us today. I know how much prospective students really value hearing directly from alumni of the program that have been through it. So I really appreciate your perspective and for joining us today. So thank you, everyone, for signing on today, and hope you found some valuable information, as I'm sure you did. Thank you, everyone.
Thanks, Andy.
Thank you.